Hey everybody, good morning or afternoon, depending on where you may be joining us today. This is Matt, and I want to first off start by saying thank you so much for choosing to spend your day before Thanksgiving with us. I know it's not the best timing, but we're so glad you all are here, and hope you find some value from this session. So let's get started. A little bit about our presenters today. If this is your first Provider Trust webinar. This is Donna Thiel, our Chief Compliance Officer, who has 30 plus years experience at a long-term care facility, a large one here in the United States. And then Mike Rosen, our co-founder and chief counsel here at Provider Trust, with another 30 years experience. So we've got our most prized thought leaders on the call today. And so we hope that this presentation brings some value to you over this next lunch hour. So today we're going to be talking about connecting HR and compliance and how that can translate to success in 2020. A little bit about us. We are a software as a service company here in Nashville, Tennessee, what we like to consider the healthcare technology capital of the nation. We have a lot of partners here, and we've been here for 10 years. We really love Nashville, and we're just passionate about compliance and HR and all the really streamlining those processes and helping you guys out wherever we can. So at Provider Trust, we believe that a smarter healthcare makes a safer healthcare, and we bring that statement to life by monitoring healthcare populations to identify compliance and credential issues before they impact patients. So we're very passionate about how these processes can affect the folks that are actually joining or that are in your facility, really from the patient to the provider to the administrator and everything in between. So we are happy to have the right people on the phone today. We are, as a company, one of our core values is to help others grow and succeed. So we are really happy to share these educational resources with you. We actually have over 300 resources on our website. If you go to providertrust.com, you can easily navigate there, and I'm certain that there's a resource that you will find valuable. There's a whole bunch in there, and we've organized it really well, so it's easily navigable for you. So I just want to say thank you for joining us today. I hope you guys learned something. And really the goal for this is for us all to grow together and make healthcare a better and safer place. Our last webinar of the year is December 11th, where we're going to cover a Johns Hopkins study in detail. And really that webinar is going to cover how exclusion monitoring can better protect patients, what kind of patients are affected by fraud in healthcare, and just some really great stuff that we got from this Johns Hopkins study that we've tried to condense and share with you in a 1-hour session on December 11th. So I hope you can make that. One note here, since it is the Wednesday before Thanksgiving, we're going to send out the recording of this session and the slides on Monday. So be on the lookout for that. Our webinar is currently pending CEU approval from the CCB. We're very confident that that will be approved, and as soon as I receive that certification, I will share it with everyone online today. So just a couple notes there before we start. Today's agenda, we're going to kick it off with why collaboration matters, and then into how to identify high-risk gaps within your organization. Then we'll be covering how HR and compliance processes can be connected, where they overlap, things like that, and then we will finish off with kind of a recap and some best practice for communicating between your departments, and really some key takeaways for you to take and put into action for 2020. So before we start, we have 2 polls today, and this is our first one just to get a feel for who's on the line. In which department do you work? We're curious if it's compliance, HR. We kind of suspect it to be majority compliance. But we really love having everyone from a department, any department, just if this topic would be valuable to you. We're curious of who may be on the line. And if you do choose other, can you specify? We're curious which department you may be in, and it helps us better kind of make sure that we send you valuable information in the future. So we'll give that just a few more seconds to close, and then we'll share just so you guys get a good feel for your peers on the line. Thanks everyone for participating. Yeah, 79% compliance. That's no surprise there. HR folks, of course, we are so glad to have you guys. And then credentialing and a few more in other. And with that, we will go on to Mike Rosen, who's going to cover a little bit about why collaboration matters.
Thanks, Matt. Hello, everyone. Again, thanks for sharing the day before Thanksgiving with us. We're very thankful for that. And hopefully we can provide you with some insight as well as information that may help make 2020 more collaborative for your organization. We like to say, Don and I, that it's a natural partnership, both HR and compliance. And in fact, we always call it peanut butter and jelly, but because Thanksgiving is tomorrow, we'll say it's really turkey and dressing, or even better, it's the marshmallows on top of the sweet potato casserole that hopefully may be a Southern thing, and hopefully you'll try it wherever you're eating. But they really are. HR and compliance play such pivotal roles in any organization, but especially in healthcare. You know, you can't really function well or in a streamlined capacity, certainly not in a collaborative way, if you're not talking to each other. And so hopefully if this is an opportunity for you to take that message to your compatriot, most of you are from the compliance departments, and you want to invite, we would encourage that you invite HR to the table and take the first step to bring these conversations more cohesively. And why is that, right? Because I am a recovering lawyer and can tell you that in the situations that always involve either a compliance issue and certainly an HR issue, which you want to avoid becoming a legal issue, HR and compliance will come together at that point. And if there has not been a natural gap or a natural bridge between the two, and this is really kind of the first time people are coming to the table together, that can really delay a proper response. It can also make a very non-coordinated effort, which is certainly not a place that you want to find yourself. So we really do believe that for multiple reasons, good and bad, HR and compliance should be collaborative. You know, most of the issues that require HR will also require compliance, and vice versa in some instances. Now, sometimes they are truly separate, and legally they should be separate. But for today's purpose, we're going to give you some ideas of where that rubber hits the road and how you get traction as a cohesive group together, involving both people and how that affects people is really kind of what we believe effective HR and collaborative compliance works. So in your organization, if you've thought about it, or if you haven't, maybe this is a way to illustrate how those two bookends, human resources on the left, compliance on the right, can operate sometimes separately, but really in a lot of cases, there's true overlap. So obviously the traditional functions of HR being payroll, benefits, recruiting, onboarding, disciplinary, I mean, those are true traditional HR functions. And it takes people who have been trained and or through years of experience in dealing with different issues, familiar with what are the policies and handbooks that you have, the way you need to follow them, and certainly ultimately helping the company be both compliant and legal. On the far end, you have compliance, or on the right side, I should say, which is also there to make sure that the organization is complying with regulatory functions and requirements, that there are policies and procedures that may need to be sitting on top of what is HR driven, or in some cases driving how HR is to perform in a compliant manner, and then also serving as the function of an auditor. And I think really when you look at compliance and how people sometimes view compliance as the cop, good, bad cop, when in fact they're really trying to help the organization stay focused and compliant and not get off track. And once you are able to find a way for compliance to communicate that, where they're not a bad cop, They're there to help everyone's lives be easier and the organization to remain compliant. When an audit is the next step, it isn't seen as, aha, we found something, this is the red pen. Instead, it is being proactive and finding things in advance of it becoming a problem. As Matt mentioned, we truly believe in everything we do when building our software is focused on making the healthcare, using smarter data in healthcare to make it safer for your patients. And if you don't do audits, you're going to find out, unfortunately, after the fact, and probably with a plaintiff counsel on the other end, of what you could or should have done. And so in all facets of what compliance is there, coming up with risk assessments, making sure HIPAA and other things are complied with, that isn't a bad cop. That is a necessary function. When you look at where those two functions, HR and compliance, which are in large organizations, two different groups, they clearly have overlap. You see in the middle, even mundane functions as how are we verifying licenses and how are we managing and sharing that information so that we ensure the people who are on the floor are properly licensed and not excluded, that you have a hotline that people know about and that they are in fact reporting things that are then being dealt with in a timely manner. How do you coordinate those things? Sometimes that may be just a compliance first step function on the hotline review, but it may ultimately turn into an employment issue or HR issue to where HR needs to be also at the table. And so you can see, disciplinary actions are probably the place where in organizations that don't collaborate, the first time compliance and HR are coming together, and it's usually when the iron is hot. Something has gone wrong. There is something that needs to be corrected, and people are under pressure in a lot of cases to do something to correct it. And that's where, if it's the first time you're coordinating, you might step into more trouble than if you had been more proactive. So tying this into the 7 elements of an effective compliance program, we believe that we'll highlight some of these where these are exactly why and where and how compliance and HR should work together on the front end. Clearly, policy and procedures should be, in some cases, collaborative between compliance and HR. HR is very astute in a well-run organization in knowing what the Family Medical Leave Act or the ADA is and how to have policies on asking for time off and disciplinary action. But then when they actually get implemented in an actual situation, compliance is usually wanting to be or needing to be at the table, because if you don't follow that procedure, then you're opening up your company for a lawsuit in non-compliant ways that you could have otherwise avoided. So drafting, reviewing, updating policies, that's a real collaborative, should be a real collaborative opportunity between HR and compliance. Now, who hires the compliance officer? Well, the HR group hires the compliance officer. So there is the first chance to really make that person feel welcomed, help them understand your culture, help them feel onboarded in a way that they're not seen as just the bad cop. And it's a great chance for HR to remind that compliance official and department how we work to help get you here, make you feel comfortable, and how we're here to support you, and vice versa. Clearly, in the eyes of the OIG, when it looks at CMS auditing, any joint commission or URAC accreditation, education and training is where it is the most visible to an outside party. You either have the proper education to document that people attended, to make sure that it is compliant with agreements that you may have signed with health plans, with CMS. If you're under a corporate integrity agreement with the OIG, they're going to be auditing to the nth degree your education and training, because you have committed to do a certain type of and a certain number of hours in certain areas when it comes to fraud, waste, and abuse, billing, whatever the issues may have been that caused the CIA. So education and training is where the rubber hits the road in the eyes of under some type of review, audit, or CIA compliance. Monitoring and auditing is how you prove you've done stuff proactively along the way. And there are, as we will discuss in a minute, between licensing and exclusions as examples, the clearest way that the two departments could and should work together. And you have reporting. Enforcement and discipline is, as I mentioned earlier, not the time for the first time for HR and compliance meeting each other on an issue or meeting each other. Because your feet are in the fire, there's something going on, there are timelines, and there are really things that need to be checked off properly. And if this is a chance, if this is the first chance the two have been speaking, you're behind the 8 ball. And then clearly when it comes to response and prevention, the 7th element of an effective compliance program, who is the first group to respond? And it may differ, right? If it's a hotline, it should be compliance. But if the issue is an HR issue, it then gets transferred to HR. So the 7 elements are a good chance to sort of highlight where if you are thinking collaboratively and acting in a proactive way, we believe you'll be way ahead of the curve when the times are really tough. There's no doubt when we talk to clients, healthcare is changing, the threats and from economy and reimbursement, there's a lot of pressure within the organization, but the tide is changing all the time. Every time you think we say here, when you see one organization, you've seen just one, because even within the same vertical, acute care, post-acute, et cetera, they're all different in how they operate and their culture and their policies. But there's true sharing of responsibilities between HR and compliance in this ever-changing healthcare environment. And oversight is really transitioning from compliance to HR in several areas. Donna's going to talk about a couple of those in a minute, but that's a real change. Traditionally, not even 10 years ago, but certainly 10 years and longer, I mean, there were real siloed verticals that you just didn't cross between compliance and HR. And today they're so intermingled and there's so many nuances that it is, in a lot of cases, transitioning from compliance to HR with clear understanding how to comply in organizations. And so you just never know when that might happen inside your organization. So with that, Donna, let's turn over some of the gaps that maybe you can help identify from your experience, 30 years experience in a very large long-term care national post-acute provider.
Thanks, Mike. I think we have a poll to start this section. Matt, do you want to take us through that next poll?
Yes, this is our second poll and our final poll. So we're curious at how often you currently meet with your HR and compliance counterpart. So whether that's monthly recurring meetings, quarterly as you kind of plan through the year, or maybe annually as you are planning for 2020, special projects only, or if you have no recurring meetings, that's okay too, because you're on the webinar to learn about how you guys might better collaborate anyway. So yeah, we're just gonna give a little time here for you guys to chime in, and then we'll close and share. Great. So 35% of you guys are meeting monthly. That is awesome. That's a really great cadence to be meeting up with your counterpart there. Quarterly, 20%, 0 annually, 6 special projects only, and 39% of you have no recurring meetings. So maybe this is a good time to, hopefully this webinar gives you the opportunity to reach out to your counterpart and talk a little bit about how your policies or procedures may change in 2020. So thanks, Donna. We'll go back to you.
Thanks, Matt. All right. So I think that really sets us up well to start talking about looking at gaps. So clearly we're rounding out the year. We're just about to turn the calendar over to December, and most organizations are doing gap analysis or looking at risk assessments. So maybe it's an opportunity for the HR and compliance teams to spend a little bit of time in a new way, looking at some of the gaps that may exist between HR compliance, or maybe just some of those high risk areas that we may or may not be currently collaborating on. So when you think about employee onboarding procedures, in organizations, we have just a variety of ways that new employees are onboarded. And I think as we look at from an HR perspective, what's probably the number one priority, it's recruitment and retention, right? And finding the right people, finding enough people to staff all of our healthcare providers. So that employee onboarding experience is really important so that we're making a great first impression. So talking between the two departments and understanding, can compliance help monitor or audit an onboarding process to give HR some feedback on how it's going? And maybe they're doing some employee interviews, but I would consider the onboarding experience a high risk area that maybe HR and compliance could start collaborating on. Training would be the same concept, right? When we look at employees and making sure that they have the competencies that they need to take care of our patients, training is a huge important component. So HR is probably oversight relative to getting it done. Compliance certainly helping with the messaging. One thing that we did in my organization was we inserted a compliance message into every single training module that we rolled out. It might have just been one slide, one little comment here or there within the training, but really leveraging the training that your staff are engaging in. Compliance, I think, could be a really good partner there. Looking at the hotline, so often we get a number of calls on the hotline, and compliance is managing that information, but we may not be sharing that with HR or other departments and really trying to see what the trends are relative to the messaging and the issues that are coming into the organization. So really making sure that there's a partnership and understanding the potential gaps in our hotline management process. Certainly that leads us easily into retaliation and allegations that oftentimes are part of our hotline process. Oftentimes we get calls on the hotline where someone is really afraid to be calling the hotline because they're concerned about retaliation. So how are HR and compliance managing that concern or that feeling that employees may have regarding sharing some concerns that they may have within the organization? Ongoing employee monitoring, we're going to talk about that and use this one as an example for some of the next slides as we talk about collaboration between HR and compliance. But when we talk about employee monitoring, we're talking about exclusion monitoring, we're talking about license verification, we're talking about administrative actions or sanctions against people or those licenses, and how's the organization, how is HR and how is compliance really managing that employee monitoring process. Credential verification is very similar, right? Making sure that the people actually have the credentials that we say they need to have in order to do the job that we're asking them to do. And then HR metrics not communicated or not reviewed. That might be a little vague, but again, we're going to talk about that in a little bit. But what are those metrics that HR that should be reported through the compliance committee? What are those really important pieces of information and metrics that HR is monitoring that compliance should be aware of and really support the initiatives that are underway? So let's talk about a specific example that we had within our organization at Provider Trust for one of our clients and onboarding with us. So I think as we walk through this example, I think I would ask you to think about your organization and how many people in your workforce, what's the turnover rate? What's the longevity? Are your staff staying with you for years and years and years? Are you seeing a greater churn? Do you have a 50% turnover or an 80% turnover, or do you have a 2% turnover? But think about the population of employees that we have today. I think most of us would agree that unfortunately, people don't stay in one organization as long as they used to. So this scenario may play out in your organization as well. So the story that goes with this example here is that in June, there was an allegation of theft that a patient made. So a patient said, someone stole, monies from me. So right away, the organization did an investigation and reported that to the licensing board. It took a whole year for the licensing board to conduct their investigation. And after a year of their investigation, they issued an administrative action against the person. So in our vernacular at Provider Trust, we call that a sanction, an administrative action against a person. At that point in time, the licensed professional had an opportunity to defend themselves, right? They have an opportunity to say, hey, here's the real world. This is not what happened. Your facts are wrong. I want to defend myself. In this particular situation, that practitioner chose not to defend themselves. They said, yes, the administrative actions are correct. So at that point, the board made the decision to revoke the license. Now, if you fast forward 7 months later, the OIG made the decision to exclude that person. And as many of you, I'm sure, are aware, the OIG has mandatory exclusion authority and permissive exclusion authority. And one of the permissive exclusion reasons is a license revocation. So the OIG made the decision that the license revocation that the licensing board made was significant enough that they too wanted to not only have that person's license revoked, but they wanted to exclude that person from the Medicare or Medicaid program. We know that SAM, the SAM.gov exclusion source, pretty much does exactly what the OIG does. So they also excluded this person at the exact same time. So now, over the course of the next 5 months, and we really don't know if it was in the next 5 months, if it was someplace in this last year and a half of activity, but somewhere along the line of this entire investigation, this particular practitioner, they moved. They changed their name and they got a new license. Now, in Wisconsin, where I live, we have reciprocity with Minnesota, so for certain licensing boards. So if this example was in Wisconsin, I may have moved over quickly to Minnesota and got a new license while the other license was being investigated. Unbeknownst to the state of Minnesota, Minnesota issued me a new license. And during that time, I got married, divorced, whatever the case may be, I changed my name. So when the new organization went to hire this practitioner, they searched for my new name with my new license. And when they did that, they didn't see an exclusion match. They didn't see any sort of issue. When that person came into the provider trust system, we were able to find that and were able to alert our client that this person had had an action under another name. So this is just, in my mind, a classic example of how staff move within the organization, and it's really hard to find them and really important for HR and compliance to be collaborating. So let's move on and look at some oversight responsibility using that same example. What would HR classically do or typically do versus compliance, and where might there be some joint role opportunity? So generally, the role of compliance is to explain the impact to the organization of an unlicensed professional or an excluded person, right? We would be responsible for figuring out the facts behind the situation with this licensed practitioner. HR would be responsible for kind of identifying the story of the employee, right? What role do they play? When were they hired? What were our pre-hire practices? Did we do the right thing? Was there any human error? Just kind of what happened in that situation. And then jointly together, we would be doing the investigation. We'd be looking at breakdown in process. We would be determining together what the future of that employee is, and then certainly determining whether or not there's self-reporting obligations or what might be that next step from a disciplinary action or from a reporting perspective. So kind of a classic model of how the two teams would collaborate. So just to take one more second and talk a little bit about professional licenses and things to know, these are just some interesting facts that we have. So almost half of the exclusions that we were just talking about under that permissive authority are actually based on license revocations. So again, thinking classically or typically about HR and compliance, compliance generally cares about exclusions, HR generally cares about licenses, but in the end, the two of them should be joined at the hip because half of the exclusions started at license revocation. So if you're monitoring licenses and really knowing the credentials of your staff, you're able to prevent those exclusions. So where to verify licenses? Each state has a licensure board Those are what we call primary sources. So for every discipline, you would have the opportunity to go to the primary source, to that state-specific licensing board, to verify the credentials. And the frequency, we're going to talk about that in a little bit more detail in a second. But generally speaking, what we see is that pre-hire, certainly everyone is verifying those licenses to make sure that they're in good standing before we bring someone into our organization. And then typically they look at them again at the time of renewal, which might be, generally it's 2 years. Every once in a while there's a license that's 1 or 3 years, but generally speaking, it's every 2 years. And we would say, again, based on that example that we just gave you, that that might leave a gap if you're not looking at it more frequently than that. So we'll talk about that a little bit in more detail. So the next slide kind of just reiterates what I just talked about from a who plays what role in oversight. Again, compliance, generally speaking, we look at exclusions, and that's because the OIG generally is talking to us as compliance professionals. Their messaging is around how to help organizations stay in compliance, what auditing and monitoring that they're doing, what concerns do they have, what good looks like from a compliance perspective. So the OIG is generally speaking to those of us on the compliance side. Credentialing typically, again, is HR, and because those are tied to people. And if we boil it all down, HR, their primary oversight are people. So they, I think, own more of the license or the certification, the credentialing side of our people monitoring. And what are we seeing? I think what Mike said earlier on is there really isn't anything typical anymore. As I spend more and more time with our clients, I'm seeing a shift from compliance to HR and more collaboration and recognition that it takes both sides of this equation in order to have really good oversight and monitoring of the people that work within our healthcare organizations. So let's just quickly talk about what best practice looks like in license verification. And again, this to me is neutral, right? This isn't necessarily what HR does or what compliance does, but what should we be doing when we're looking at helping make sure that the people taking care of our patients have the licenses that they need? Certainly, we'd be looking at making sure that there's policy and procedures for governance, making sure that we know what our cadence is going to be and what our expectations for verification and monitoring looks like. Understanding and navigating the primary sources, verifying right at the primary source or using a third party that goes to the primary source on our behalf. Documenting what are we doing to prove it, right? We know that when surveyors or auditors are in our facilities, they want us to show them that the license is in good standing and what action we've taken to verify that. Document any actions that we've taken, right? If we have a situation where someone was unlicensed or they had a sanction on their license or they were excluded, right? What are we doing? How are we documenting our actions? We just talked about being survey ready, making sure that we know where that information is stored. What system do we have? In my previous organization, before we used Provider Trust, we had Excel spreadsheets that we used in each one of our nursing facilities to manage the licenses, because that was the quickest and most effective way that the team had done it when we were in a decentralized model. And then really making sure that the staff, that we know that that everyone has the license that they need, that there's an expectation of reporting if there's ever a violation or anything happening on the license. So Mike, why don't you talk to us a little bit about the frequency and what I should do relative to this example of verifying licenses?
Sure, thanks, Donna. So, this is going to depend necessarily on what vertical you're in and what type of licenses you need to verify and how often those are could be changed. In most cases, that should be monthly, but in some cases, certificates in particular, they may be issued and not. There is no disciplinary board. Once you have it for a 2-year period of time. So, in general, though, HR and compliance need to be both in sync and know the frequency of when license should be verified to make sure that no individual is getting care in your organization with someone who isn't licensed or who is excluded at the time of care. What is reasonable in most cases is at least to be checking that on a monthly basis, because that is for most licenses when they are updated. Now, there are some boards that do license updates daily and can make changes. And in particular, when you think about physical therapists, occupational therapists, people that are seeing and documented treating people for billing purposes and billing for those hours, those are the ones that typically we see clients that are interested in a more updated license cadence like daily, to make sure that they ensure that each day that person is in good standing and can do what they're being tasked to do, as well as get reimbursed for it. But traditionally, when we ask clients, and normally we have a poll question here, we don't have time for it today, but traditionally when we do, we find that most of our clients are certainly doing a background check at hire, because most states require that in some capacity for healthcare, but then they're not really doing license verification again until that license renews, which can be 2 years or more in some cases for most providers, which gives huge gaps to in between, in which you potentially are exposing your company for liability when you're talking about a credentialed provider. So really, how frequently do and should you do it? I mean, best practice is monthly. It would be certainly the best way to avoid, and most reasonable way to avoid changes that occur from a licensing board on a monthly basis. But if you just do it upon hire and renewal, that is a long time to not be checking the credentials of people that need to have certain things. So understanding your market, your license type provider base is important in this case. Here's an example of how, when we looked at a study involving Medicare beneficiaries who were exposed to some type of fraud or abuse. This study was done from looking at people in the healthcare sector who had as a result of fraud and abuse or revoked license, were providing care between 2012 and 15. And what's really kind of sad and scary at the same time, fraud continues. No surprise, I'm sure, to the people on this call, but fraud continues to be a basis for which people are going to cheat the system. And fraud can take multiple forms, whether it's billing, et cetera. But look at patient harm, which would be more of patient abuse or neglect, as it pertains to beneficiaries in the system. And as a result, the far right, how many of those people it was due to a revocation of a license? So here's an example that highlights, if you were only checking that provider upon hire and renewal, and their license had revoked in that 2-year period of time, the gap and exposure that produces to you and could cause patient harm, and in some cases, if not most, is also considered fraud, because you are submitting claims to CMS for reimbursement, which is a false claim, if the provider was in fact not licensed. The fact that you submitted it and they were not in that category of being a licensed provider is considered fraud under the FCA, the fraud provision for DOJ and U.S. Department of Justice. It also will lead most cases, if you're not aware, 43, it varies between 43 and 48%, depending on the types of actions taken each month, of the OIG excluded providers are there because of a license revocation. So these are early indicators that you could be checking on a monthly basis. So we would challenge you for 2020 for HR and compliance to evaluate or reevaluate your current process on how often you're checking not just your employees, but also your vendors and your referring physicians and the other people that that are in the healthcare ecosystem with you. And how accurate is your credential information? As Donna mentioned and highlighted in that chart earlier, maybe people have gotten married or divorced or changed names. Maybe they're doing it most likely not to game the system, but generally speaking, when we find somebody, they purposely give a name in which they know they're not excluded when they know that they've in fact changed that name, so you won't find it. And how do you build your processes around to check all names known to that individual? Again, Donna's example of living in Wisconsin and in long-term care having Minnesota as a reciprocal compact state license, that matters. Where is that person living? What is their residence as to which license they need to have to be able to work in an adjacent or a compact state license across the country. And you can see things here that, again, highlight why HR and compliance need to work together in a cross-functional way. So Donna, let's talk in the remaining 20 minutes about compliance collaboration, an example of really how it works well from where you saw it under a company that was in the midst of a corporate integrity agreement. We're having a technical issue with Donna. I'm gonna when she comes back on, we're gonna have her do that. I think she resides in Wisconsin, where they're having some storms and has lost power. So we're gonna come back, but I think if we can get her back on by the end of the thing, that'd be great, because her experience in dealing with not only in an organization that was under a CIA, but negotiating it, and then what had to be done to comply with certain things would be of value to this organization. While we're waiting on Donna to get power and be able to reconnect, we're going to move to the next slide. So imagine your organization in 2020 if onboarding, which Donna really spent a nice time talking about, you actually had metrics that both monitored and reported to the compliance committee on a regular cadence, so that when you, compliance, are going to or submitting a report to the compliance committee or presenting at the board level, that it actually reflects what's gone on in the last 90 days of your organization. I know for some of you that seems like a dream, and for others it seems like the floor, and that puts compliance in an awkward position if they're not there. But imagine how and what are the things that you need, what are the metrics you would want to track. We ourselves here at Provider Trust are implementing a system called Traction, which is a way for us to set our goals and look what the rocks are necessary on an individual level and all the way up to company goal level to meet those, making sure that what we're focusing on is what will drive success in the business, but holding ourselves accountable to when they're off track. And we meet on a weekly basis to review our scorecard to see how we're doing. These are the kinds of things that metrics can help build your organization in a collaborative way. Hotline calls, certainly they generally will spit out some type of HR issue involved as well as compliance, but how are you tracking them, and are you discussing them weekly? If they're coming in, you need to deal with them on a timely basis. And what if you had compliance that assisted with the root cause analysis in what went wrong in certain cases? You want compliance at that table, if not driving that discussion along with operations and other parts of your organization, so that the mistake won't be repeated. So these are the types of things that involve collaboration. You see others here involving investigations, onboarding, auditing the onboarding of people for compliance, and the role of HR coordinating with a chief compliance officer. While we're waiting on Donna to get back, I'm going to pick up and talk about the connecting. Are you there, Donna?
Oh, I'm here. I dialed on my phone, so I apologize. We lost power at my house. We have terrible windstorms today. Can you hear me okay?
We can.
Yes. So Donna, we're on slide 28 and going to talk about connecting. But if you have a moment, I was hoping you could spend a few minutes talking about your experience on how collaboration worked well at your previous employer and how you saw that working well.
Awesome. And I apologize, everyone. Thank you, Mike, for keeping us going. So, so on that what if slide that Mike probably just went through, really wanted to just highlight the fact that if you have collaboration and you're thinking about these things on a daily or at least a routine basis, and you're comfortable picking up the phone and talking to your HR colleague, life can be so much better. Having that partner in the organization that you can rely on, that you can walk down the hall or you can do whatever you need to do, is just a really comforting feeling. And for me as a compliance officer, when I had that partner whose office literally was right down the hall from mine, where I could just get up, walk down, have a conversation, they could run into my office when we needed to jump on board, it really just makes life so much easier for everyone involved. So I know we've done webinars in the last year and really tried to highlight HR and compliance, and just absolutely believe that this is a partnership that to be successful in the compliance arena, you have to have a great partnership with our friends in HR. So let's keep moving and start talking about connecting HR and compliance processes. So the next slide, I can't see, so I'm just going to keep assuming that you guys are moving where I am. So collaboration starting at the beginning, certainly making sure that we know that we're doing background checks and criminal background checks, abuse registries, all of that stuff is where we have an opportunity to partner together. Consistent messaging. I am all about culture and messaging of, doing the right thing. When I did my training, I talked to my teams, and I would always say, if your stomach doesn't feel right, you need to tell somebody. So consistent messaging between us, between HR and compliance, making sure that we're on the same page. The code of conduct and employee handbook, right? Those are generally speaking, two different documents, but yet they should really carry a lot of the same messaging between the two of us, both HR and compliance. We've talked a lot about licenses and certifications, and then really compliance with state and federal laws. Both HR and compliance have a ton of regulations that we're responsible for. So making sure we're on the same page and understanding what that looks like. The next slide talks about collaboration happening every single day. We did the poll and we talked, a number of you are having monthly meetings, which is awesome, but really feeling comfortable just collaborating ad hoc on things that come up on a daily basis. Certainly joint values and messaging is important. Talking about monitoring staffing and turnover metrics, that might not be daily, but I'm guessing that if you don't have a dashboard, you have some mechanism as an organization where you're really monitoring certain staffing and HR metrics. And I think it's important that compliance sees that and is part of those conversations. We talked about regulatory changes and making sure we are monitoring and figuring out how that impacts the organization together. Certainly disciplinary action reviews happen at any point in time, right? We don't schedule those. Unfortunately, they are just a component of our daily lives, and making sure that we're comfortable talking about that as they come up. And then we talked about licenses and exclusions and hotline investigations. Are you just getting an HR, in my company, we had a compliance hotline, an HR hotline, and a family line where our families could call. Compliance could see all of those, but really making sure if you have one line that's for all your employees, and you're just, if compliance is, quote, delegating the HR responsibilities, making sure that there's some follow-up and closure, and knowing that we have jointly decided best practice. HIPAA, right? HIPAA is a thing, and compliance owns it, but at the end of the day, a good portion of our breaches, our concerns relate to people and the actions that they take. So another area where I think HR and compliance can collaborate very effectively. We've talked about safer healthcare from properly licensed providers. Matt shared at the very beginning our viewpoint at Provider Trust of how important it is that you have the right people taking care of your patients. So here we just kind of walk through a holistic approach when we look at people monitoring and how do we make sure that we are doing it at a cadence that feels comfortable in our organization, that makes sure that we're not missing something as it comes about. Do you have policies and procedures, or is it in your employee handbook, in your code of conduct? Do you talk about self-reporting, that your staff knows that if they're a licensed practitioner, that if there's an issue, they need to come forward and share that with you in real time so that you can properly make good decisions about whether or not that person can stay on your team. The next slide just starts talking again about creating a smarter license verification process. And I think this speaks for itself, but making sure that your policies are clear, just what I was just saying about expectations on your team to self-report. Is there internal fragmentation or variability? Like in my previous organization, before we standardized, we had a very decentralized process. The facilities operated on their own in managing the licenses So look at your process and see if you can streamline it. Can you enable your team with some tools, right? Is there a place of a single source of truth? Again, at Provider Trust, that for my company, Provider Trust was our single source of truth. We relied on them to do all of our license and sanction and exclusion monitoring on our behalf. Create accountability and transparency. Again, making sure people know to come forward if they have any concerns. Documentation, we all know the old adage, right? If it wasn't documented, it didn't happen. So making sure that you're keeping good records of the actions that you're taking. And then, of course, we've kind of said this over and over, but making sure that you have a frequent process in place. So let's just kind of wrap up today's conversation about best practices between HR and compliance. We've talked a little bit about this in different kind of typical roles of HR and compliance, and talking about, the recruitment and the retention and turnover, onboarding, competencies, investigations, generally speaking, live in our HR friends domain. Compliance, we tend to be, I put day-to-day crisis management. I think for all of our HR professionals that are on the call today, I think they would agree that they have day-to-day crisis management as well. That's just the nature of the beast of our jobs. So we understand the roles that we each play and the kind of, quote, primary perspectives of our roles. But in my opinion, it's only together that we can really, truly help others grow and succeed. Either Matt or Mike said at the beginning, one of our core values is helping others grow and succeed. And we do believe that this partnership will help you grow within your organization and make sure that the right people are caring for your patients. Collaboration on the next slide absolutely matters. Building a culture of compliance. Again, in my world, we use doing the right thing was the message that we consistently shared across the organization. I think that is a message that HR and compliance can comfortably and jointly share within your organization. We know that whistleblowers are a daily concern, right? If team members have concerns that they're raising, whether it's to HR or compliance, and we're not listening or we're not responding, we're not being consistent and fair in our investigation and our remediation, that produces a whistleblower, not anything that any of us wants to have to deal with. We should be familiar faces out and about. In the end of my career on the provider side, we had a corporate integrity agreement and we had a quality monitor, and I was out in the facilities more than I had ever been in my entire career, and it was the best thing I could ever have done. People knew who I was. People felt comfortable calling me. Every visit that I did, I left my business card and handwritten notes in the employee break rooms. People need to know you to make sure they feel comfortable communicating with HR and compliance. We talked about the importance of the code of conduct and the employee handbook really being good collaboration between them, consistent messaging between those really important documents that your employees are receiving on that very first day that they're joining your team. And be one message. It doesn't matter if the compliance officer is speaking, if your human resources team is speaking, it doesn't matter. It's one message. It's a consistent message. It's being fair, respectful, being expeditious in the way that we're responding to concerns within the organization, just really making sure that we are on the same page. And then collaborating on people monitoring. Again, kind of using this as our example throughout our time today, but defining that process. What's the frequency? Where are the data sources? Are you going to do it yourself? Are you going to use a third party? Who's going to oversee it? What roles do compliance and HR play? How are we going to share these responsibilities? Who's going to take the primary lead on doing an investigation or making those decisions? Who's going to complete the investigation? Making that decision if there's disciplinary action or a reportable event. The reportable event is multifaceted. It could be a reporting event to a licensing board if it's an action within the organization. If there's an allegation, how is that going to be reported to a licensing board? It could be if we found that we had an unlicensed practitioner or we had an excluded person. So now do we have to self-report to the OIG? Do we have to self-report to our state Medicaid? Do we have to report to a third-party payer? Really understanding how that process is going to work. And then when we look back and we look at what happened, what caused it, was it a breakdown in process? Was it human error? Do we have a poor process? Do we not document it well enough? People couldn't follow it because we didn't give them the tools that they needed or the direction that they needed. And then really looking at process improvement and corrective actions. How do we get better? How do we make sure it doesn't happen again? How do the two teams, HR and compliance, work together better? Really just sharing and looking at best practice. And communication is key. No matter what, you have to feel comfortable communicating between the two people. Like I said, being able to walk down the hall and talk to your HR folks. If you're remote, if you have an organization where leadership is in different places, being able to pick up the phone. And really, from a compliance and HR perspective, 24 hours a day, right? Our jobs unfortunately don't happen between 8 and 5, happen at 4:45 on a Friday afternoon, or today on a Wednesday right before a holiday seems to be the crisis day. Make sure that we're not working in silos and that we really understand the metrics together. We understand what our information is that we want to share between our two groups. And lastly, how do we plan for collaboration in 2020? We talked at the beginning that, December is oftentimes an often opportunity for us to be doing our risk assessment, our audit plan for the next year, for 2020. So I would encourage you relationship with HR and compliance, define our roles, our responsibilities, really understand what we do. Perhaps, is there duplicity between our roles? Are we doing the same thing and we didn't even realize it? Can we just leverage the other person? I missed the slide. I'm sure Mike handled it while I was off for that little bit. But what can compliance do to help HR, and what can HR do to help compliance? If I'm out and about, what HR messaging can I be sharing? And if HR is out and about, what messages can they be sharing on behalf of compliance? So really understanding that. Figure out what those risk areas are that we want to jointly tackle in 2020. Are there things new metrics that we want from the other side of the table to bring to the compliance committee so that we have better metrics? Or is it just metrics that as we meet on a weekly or monthly basis that we want to share between our two teams and make sure that we're watching in the coming year? And most importantly, create a cadence for communication. Put it on the calendar. Don't just leave it in that ad hoc mode. Really get it on your calendar, schedule for it, prepare for it, and work together to have a better 2020. So in the end, it's all about partnership. This happens to just be a dashboard that we have at Provider Trust, but it doesn't need to be a dashboard. It just needs to be a collaborative and committed approach, I think, between the two teams. And I think you'll find that it's really nice to have a partner on the other side of the table, whether it's HR or compliance, whichever side you're sitting on. So with that, I will wrap up. I apologize that I lost power here at my house and I wasn't able to be on for a little bit. We are so thankful for all of you joining us again in November and for all the webinars that we've done. We look forward to December, wrapping up the year, and to a great 2020 at Provider Trust. So Mike and Matt, I will wrap it up and let you have closing comments.
Great. Thanks, Donna. And I just want to say thanks to everyone on the call today. We really appreciate you choosing to spend this hour with us the day before Thanksgiving. Thanksgiving is my favorite holiday, and I hope that you have a great time with family and friends, and whatever you may be doing, I hope it's a restful time and you're able to recharge. And I hope that you found this presentation valuable, but mostly I hope you have a great Thanksgiving. And we will hope to see you next month. Thanks again, everybody.
Thanks, everyone.